Welcome to the Mental Awareness Foundation series of mental health checks, which is a series of interviews and conversations we're having with people in the community that can help offer advice or make us feel good about ourselves. And whilst people we can talk to can bring us up to speed is what's helping in government levels and official levels. At MAF, we're all about breaking the stigma and creating more awareness to mental illness. So please like and share this interview and this conversation across all your networks, because you just never know who we might be able to help. But today's guest, he's a friend of mine who we thought would be absolutely perfect to talk to in this difficult and ever-changing time that we're facing. He's a legend in the mental health community with decades of experience. He was part of the team that formed the Mental Health Commission, and now he's our guest speaker, the one and only. He is the Queensland Mental Health Commissioner. Please put your hands together for Ivan Frkovic.
Thank you, Tudor. I feel really welcome here. It looks like you've got a big crowd there.
Yeah, mate. They're all. Did you like that? That was great.
That was good. Thank you.
I was worried if you were going to be able to hear that, but Ivan, mate, how are you going?
Look, good. I think sort of at a personal level, I'm going well. I'm trying to stay healthy and well myself, so I can actually support, the Queensland community in terms of the mental health, particularly impacts of COVID-19. So I'm good. For me, it's all about staying healthy myself, and for me, the biggest thing in terms of keeping myself healthy is my family. And I'm a granddad now. I've got a couple of grandchildren, one here, one in Melbourne, and one on the way. And I've got 4 kids. So I'm sort of that's my sort of major protective factor.
Just before we deep dive into the conversations today, I've got a list of things I want to run past you. But mate, just for people who are watching this video, can you just share with us in 30 seconds who you are? You've got an incredibly sexy voice, my mother says. So you've got an accent. Where does that accent come from? And Frkovic, it's not your typical Aussie Smith or Paul. So
it's not Smith or Jones, is it?
Yeah, correct. My name's Tudor Vasile, and they go Tuna Vasile. So mate, where are you from, Ivan? What brings you to where you are today?
Yeah, look, I was born in Croatia. I came here as a 7-year-old with mum and dad. I'm the only child. We sort of left the former Yugoslavia, Tito's dictatorship. We came to Australia, a beautiful country, and we've been here basically ever since. We've been here in Australia now for 50 years. So this is a phenomenal country, and I'm so I suppose honoured to be in a country such as Australia. I'm married with 4 kids, and I've got a couple of grandchildren, one on the way. Look, I've spent most of my life, my fundamental degree is actually as a social worker, and I've done my master's as well in social planning, etc. But look, I've really worked my way up through the ranks in mental health in Queensland. I probably, this year, I think it's about 27, 28 years in mental health specifically. Prior to that, worked in Centrelink, as it's called now, but also in the multicultural non-government sector. So I've got a broad range of experience, but it's also my own life experience, both coming here as a migrant kid and growing up in sort of in Australia, and also experiencing a lot of the challenges that lots of people do experience, and sort of being able to sort of be quite resilient through all of that, and survive the ups and downs of life that we all have, and then was invited by the minister some 3 years ago, would I take on the role to be the Queensland Mental Health Commissioner, which is sort of an honour in many ways, but it was also something that I thought about really, really hard, because I think part of my biggest challenge in all of this is about what contribution can I really make, and it wasn't even so much about the job itself, it was about the expectation of people out there of me, that I could actually make a difference, and that I could make some changes that were required, and I could influence government and bureaucracy and the community, and tackle things like you said, stigma, etc., that I could lead some of that. So that, that weight of expectations is always with you in these types of roles. But I have to say, I've had a great time over the last 3 years.
And probably just on that, my team was saying today something that just said about you, Ivan. You are so passionate about mental health, and they just asked. They wanted to know why is Ivan so passionate about this? Is there something personal that relates to the mental health?
That's quite interesting. My passion has grown over the years as as I said, but no, I don't have mental illness in my close family. I haven't been touched by mental illness. I mean, but obviously I've again, as I said, I've come here as a migrant child. We've had a tough time as a family, reestablishing ourselves here from basically zero. I built a level of resilience. But I understand the pressures, that people go through, and obviously I've had my ups and downs as well, but never to a point where I've actually experienced mental illness. I think I've had some stressful times in my life. I've also had some great times. So I've really this has grown on me in many ways, because I'll tell you where I make the link, because I understand some of the things that people feel when they are not seen as equal in our society. And when I first came here, I felt some of that, being a migrant, couldn't speak the language, etc. And I fully appreciate and understand how someone living with a mental illness, it's totally different to what I experienced, but living with a mental illness and how you can be marginalized from the broader community as being less worth, less able to do things, etc. And for me, I think it's always been a social justice issue about making sure that, for me, everybody is equal, everybody matters. We're all people, we all matter. And I think that's what drives me all the time, and particularly with people with mental illness or drug and alcohol problems. How can we make them feel, as one of my colleagues says, we have to build a society where we bring people from the margins into the center, and we say to them, we believe in you. We believe in you. Society believes in you, rather than society pushes you out into the margins.
Well, look, I can personally speak on behalf of myself and everyone at the Mental Awareness Foundation. We can feel your energy, we feel your passion and your enthusiasm, and we thoroughly support everything that you're doing. And thank you for your time today, Ivan. So
thank you. It's my pleasure.
Well, let's deep dive into today's conversation. Look, today I felt it was perfect timing. Look, it's a tough time out there in the world at the moment, Ivan. As we know, everyone's doing it tough. Whether it's financially or personally or mentally, and being stuck in isolation can really set off some triggers with one's mental health. Today I just wanted to touch on a couple of key areas. One, I wanted to talk about your article or your press release you sent out earlier this week. I thoroughly enjoyed it, and I think you covered a couple of key areas that I definitely think we need to highlight in layman's terms, please, Ivan. Yeah, and I really want to talk about the Queensland Mental Health Week in October, something that I think all of Queensland appreciate and are passionate about. And if we have some time, I'll talk about any involvement from the federal level. But look, deep diving down into your article you released, look, when reading it, it took me personally on a bit of a roller coaster ride. I think the reality of everything started to set in. You used the words or indicators that a mental health pandemic is unfolding, along with a range of other worrying social issues. But look, what I enjoyed about the article is you didn't focus on those issues, but more about how coping strategies of how we can get through this as a community and as family members, how we can do it together. But before we talk on that as well, just to bring into context, I just do want to talk about what are you actually seeing in the community at the moment that gives you the presumption that we're having a mental health pandemic that's unfolding? What are you seeing happening at the moment?
Look, I think using the words such as mental health pandemic is probably a bit at the extreme level to raise sort of people's consciousness. My preferred view on this is that we are all exposed, everybody in our society, to a level of vulnerability. This pandemic has exposed us all to a level of vulnerability. And that includes people, and as I say pretty regularly when I'm asked to talk, 60% of our society prior to COVID-19 was well, psychologically well and mentally healthy and strong and well, etc. And then you've got people that are obviously vulnerable prior to the pandemic, but then you've got people now who are also impacted by the pandemic and a lot of other things such as loss of jobs, but then you've got people who are living with mental illness prior to the pandemic, but also now. And I think that vulnerability cuts across all those groups. We are all vulnerable. We all have a whole range of vulnerabilities. So people that were well overnight, I've got to school my kids at home, my husband just lost a job, how am I going to pay the mortgage, etc. So we start to move into that vulnerable group. The people that were vulnerable before this, so people that might have been unemployed or people that might have been homeless or etc., they become impacted now because all of those things, they become directly impacted, and so they're in a different kettle of fish. But then you've got people who are living with mental illness, and this added vulnerability causes them in terms of how do I manage my mental illness, how do I get support and treatment, but also it has a major impact on their families and carers who are supporting them because they don't know what to do in this particular situation. They're also very vulnerable. So I think it's a spectrum or the continuum of vulnerability which applies to all of us in this current climate. And as I say to people pretty regularly, it's about understanding that we in Australia are really good at dealing with natural disasters. We've dealt with cyclones, floods, fires, drought. We've got plans, we know what to do, we know how to respond, etc. This is different. We have no answers here. We don't understand a lot what's happening. And it's that difference between what we know and what we don't know that's causing the psychological distress.
Yeah, you did mention that in the report, that you talked about natural disasters versus COVID-19 model. You separated, and it was great. And you mentioned that, you looked at what we know about the mental health effects of a natural disaster and how this pandemic differs.
Yes.
I found that very interesting because because in both situations there is a crisis. However, it is quite evident that it is different. Can you share with us your findings or the evidence that you've come across in your perspective which separates the two, and how we're in uncharted waters at the moment?
Correct. Basically, the evidence would suggest when it comes to, say, for example, because we're in Queensland cyclones, we start to monitor the cyclone coming towards the coast. We understand at what time it's going to sort of reach shore and particularly hit a part of Queensland. We prepare for that. We get people into shelters. You do a whole range of things. The rest of the country is gearing up to respond after it's passed through. So we have a plan and we know how to respond to these things. When it comes to COVID-19, we have none of that. We didn't know how it started. We didn't know how the infection rate started to come. Then we realized it was, the cruise ships and people coming from overseas, etc. But we don't have a response. We don't know what to do. So in this context, the best thing that we could do was a preventative measure, which is all the public health stuff, which is around, physical distancing, wash your hands, etc. Because we don't have either a treatment for it or a vaccine for it. So there's a lot of unknown. So people, when you don't understand what's happening and how to respond, and you don't understand the timing when to respond, people then experience a range of fear, a range of anxiety. They will experience a whole range of physical issues, like, for example, headaches or unable to sleep in this environment. I'll just use some examples that we get from town. People will experience things like, for example, cognitive issues around difficulty in concentrating, worrying excessively, or even feeling helpless in this situation. I don't know what to do. I don't know how to protect myself or my family. But emotional issues as well, such as anger and moodiness, but also people have started to turn to things in terms of behavioral stuff, increased alcohol consumption, but also we've seen the media start to cover, and there is some evidence, increase in domestic violence and relationship problems, etc. So we can see some of those things playing out, but we don't have much control over them.
I do like you're going into now, which we're very big on, is spot, speak, support, and it's looking out for spotting the signs.
Yeah. And
you did talk about that, but just to go back a little bit on the natural disaster and COVID scenario, is it like, not to put you on the spot here a little bit, but isn't this a similar experience to SARS pandemic we had in 2003? And hear me out first. Obviously, there are differences in the day-to-day effects that SARS has caused to what we're having today. But isn't there some similarities from that experience and learnings we can take that we can apply to now's pandemic that we're having to I guess, speed through this experience that we're having?
Definitely. I think we can learn from the GFC, the SARS, even the Spanish flu, which was, in the 50s, whatever it was. We can learn from all of those. But again, I don't think this is, that's why they use the word unprecedented. It's never been of this magnitude and this sort of impact. We're seeing, hundreds of thousands of people die around the world. We're seeing millions of people infected. And in a whole context, Tudor, where we don't have a treatment for it or a vaccine. Now, even if I take your example around SARS, from my understanding, we still don't have a vaccine for SARS, but we're managing it in different ways. We've got some level of treatment, we're managing it in different ways. But this one, there's so much unknown and uncertainty, which I think is what's causing the problem. And when people are uncertain and they don't know, level of fear and anxiety, hopelessness, fear for your family, your kids, and etc., starts to escalate to a point where some people can manage with that, but other people may not be able to manage with that.
Yeah, understand. Mate, with regards to, something that we're very big at the Mental Awareness Foundation, it's we have this initiative called Spot, Speak, Support. You may have heard it before, and it's Spot is all about looking out for the signs. Speak is about encouraging those ones to go and speak and communicate to the ones that are potentially suffering. And then there's Support, so go up them and guide them in the right direction. Speak to a doctor, go get some help and support. Mate, you talked about identifying the signs. I found this interesting. It's something I resonate to a lot with because we at the Mental Awareness Foundation have that initiative. Yeah. And but one aspect I found with that initiative is Aussies tend to fall over when it comes to identifying the signs of mental illness and those suffering, distress and anxiety. We don't tend to see those signs. In the report, you identified them, and you went to touch on it just before. What have you identified as the signs that we as Australians need to look out for?
Look, I think, some of those, it's more, if you think about, if I just look at the emotional signs rather than the sort of cognitive, physical or behavioral, the emotional signs are going to be things like anger. People are going to be angry about not being able to do things, can't see my family, can't go visit. My elderly parents in a nursing home, so people will be anxious around a whole range of things. Anxiety levels will increase about, can I do that? Will I be exposed? Will I not be exposed? People will also experience a level of depression, lose that passion and that sort of thing because I can't go out, I've got to stay at home, etc. So people become a bit more isolated, and I think, in a broad sense, a level of depression will set in. But also you will see a level of moodiness, and we saw some of that in the way people shopped and, went on these shopping sprees for certain items, etc., etc. That's all about that, trying to take control of something that you've got control over versus the bigger thing that you have no control over. So I'll buy toilet paper or I'll buy, a rice or whatever it is. People taking control of something in an environment where they have very little control. But also people have lost a lot of motivation. Some people, struggling to, keep motivated in this particular moment. So in the emotional space, all of those things are going to be some signs and symptoms. And we all, and look, it's hard, you don't have to be a clinician to actually do this, but you will notice as a person, and I will notice as a person, if there's a change of behavior, emotion, or even some physical elements to some of our friends and relatives and people in our social network where they're not coping, something's not right. And then it's not about diagnosing it, it's about saying, how is that going for you? What's happening for you? And giving them the option, as you say, where do we then get them to go and get some support?
What, just on those identifying the signs, I'd be interested to know, is there a common sign that seems to be more prevalent than all of them from a physical, cognitive, emotional, behavioural that people should be more aware of than others?
Yeah, look, I think the most common thing that's been identified now is that level of anxiety, that, having minimal control over what's happening around you in your environment causes you to be anxious about the situation. I think anxiety seems to be the more common thing that everybody's talking about. But look, there is certainly levels of fear. Fear is also, fear and stress and all those things. But anxiety would be the sort of the strongest that and look, anxiety is a number of different, I suppose, emotional expressions. It's not just one thing. There's a whole range of those things, but anxiety would be the most common one at this particular stage.
Look, I'd have to agree with you, because I think personally myself, I've never felt such a heightened level of anxiety because of this whole experience, not knowing, I'm a business owner, and not knowing how to act each day. Normally you have a plan for the month or for the 6-month forecast and your strategy, but I don't know where to turn tomorrow, or where my next job will come in, or what the business environment looks like, or will I have enough money to pay the bills tomorrow, or will I be able to keep my staff? There's so many elements of anxiety and concern that is just layering and building up, that I can definitely relate to that statement. But as an organisation, what can organisations do to respond to those signs? Is there, are there programs that you've recommended in the past that we can all get involved in for responding to these signs?
Yeah, look, I mean, I think, both the federal and the state government have responded in this. And, one of the ones that was funded under the federal government's flagship was around funding Beyond Blue, for example, to provide digital support and online and phone support to people in distress. So people that might feel a level of anxiety, a bit like, some of the stuff that you spoke about in your own feelings around your business and etc. So people can go, there's sort of Headspace, there's a whole range of lifeline services where people can go and talk to people around some of that stuff. The other thing that we also have available is that, for example, the medical benefits scheme, for example, now you can digitally talk to your GP, and you can get what they call broadly a mental health care plan, and you can get 10 sessions with a psychologist or a social worker or an OT, all funded under the medical benefits scheme, and there's no gap payment, which is what's happened now during this COVID-19. So people can get and talk to a professional, psychologist, social worker, and OT, to talk through some of the issues like you've identified. But then we've also had the state governments funded a whole range of non-government organisations to particularly support people with drug and alcohol, mental health problems, etc., who are living in the community. So more of that psychosocial support rather than the clinical support. So we've had both sets of governments respond. And in fact, only this week, I think there will be a plan, a national pandemic mental health plan going to National Cabinet, where the Prime Minister and all the state premiers are hopefully going to endorse a national plan around how do we tackle mental health in the short term, but also in the long term when it comes to COVID-19.
Now, is this because we've seen a increase in you hear it a lot, they're talking about a lot in the news of increased family and domestic violence, alcohol and drugs and so forth? Is this been a reaction to those increased areas?
Partially, we've seen an increase, particularly to some of the phone line and online digital type of platforms. Anywhere increases between 30 and 50% to some of these calls where people are making to get assistance. We've definitely seen an increase. We haven't seen a major increase to our mental health services at the state, but at one stage we had a brief reduction in the number of people presenting with mental health problems to emergency departments and inpatient services. That went down because I think there was a bit of fear about going to hospital potentially.
Wow.
And now we're seeing those numbers getting back to what they were prior to COVID. But I think over time we will see more some of the reactions in terms of psychological distress for people who will be looking for support. We've seen about a 50% increase in people actually accessing, for example, their GP to get 10 sessions with a psychologist paid through the medical benefits. So we are seeing some increases in those, but I would suggest they're more at that sort of medium to low level need, not the extreme need where people are just looking for that support to be able to cope at this particular point in time.
Yeah, I understand. Mate, one thing I just want to touch on, we talked about the signs. You go down in that report, which I really appreciate. You talk about the stepped care approach with the support, but I just want to encourage that people who are listening to this, that asking those three famous words, "Are you okay?" is something that I found some Australians find daunting to ask. And I know previously, before I got into the mental health space, going up to a friend and just asking those questions, "Are you okay?" I just was very nervous on more so probably how to handle if they were to open up to me. So, I encourage anyone to listening to really look out for the signs, communicate, speak, ask those questions. Are you okay? Look, I'll probably put you on the spot. Are you providing education? Is that part of your framework at the Commission to provide educational programs to get people communicating better? Or is that things like awareness programs that you get behind with Walk for Awareness with the Mental Health Commission, with the Mental Health Foundation and so forth?
Yeah. Look, we are, and so we support a whole range of initiatives across the state, as you know, for World Suicide Prevention Day, Mental Health Week, particularly, you know, your foundation in terms of the great work that you do. We're also having discussions with Queensland Health around the Dear Mind campaign to repeat that, to be able to get people to start to understand those messages, as you say, feel comfortable to ask, are you okay? And it's also about giving people the confidence that it's okay to ask for help. It's not a problem, and there's a whole range of help available. It's about getting people to feel comfortable to ask for that. But also a lot of times people don't know where to go and what's the best option, giving them an opportunity to be able to channel them in the right support that they need. I think there's a range of opportunities, and I think there's lots of things that are being funded by both state and federal governments that we've just got to get the message out, as you say, to, you know, first of all, for us to feel comfortable to ask people, are you okay? But also then to be able to get a broader message to our community. It's okay to ask for help. If you need help, that's okay.
Yeah, mate, it's the work that you guys are doing and your predecessors, it's definitely working. I know I've been in this game. We're up to our 10th walk this year, and 10 years ago when we talked about asking the question, are you okay, and suicide and depression, not many people were forthcoming with their experiences. And now it's great. You can go into a workplace and it's improved. We're getting there, and you can go into a workplace and you can feel comfortable to have a mental health day. So you can definitely see that your hard work and the country's hard work is paying off. But mate, you talked about the support networks, and we're just coming towards the end of this, but I think this is very important. The response you provided in that report was we can help provide to deal with psychological stress and distress. You use the model stepped care approach, which I must say I wasn't I haven't heard about before, and I just thought I thought the support approach was just as simple of pointing people in the right direction to getting help. Can you just take us through that stepped care approach, and then connect that with the support networks that we have today?
Yeah, look, I mean, I think I'll try and sort of break it up fairly, in fairly basic terms, layman's sort of terms. Yeah. Different people will have different levels of needs. There will be people with some very basic primary psychological distress needs where they want to get some support. Now, that could be online, that could be self-help groups, that could be a whole range of things. Then there will be people who will have that moderate level of need where self-help and that sort of, going to a support group and doing stuff online, etc., may not just cut it. You may need to go and see your GP, for example, and that GP will give you a mental health care plan to go and speak to a psychologist or a social worker over 10 sessions and work through the issues that you've had. The next level up, and this is the stepped care as we're going up, people who start to show the early signs and symptoms of mental illness, mental health problems. Now, they're going to need a whole range of support. Now, they might get some initial support from a GP and a psychologist, but if their level of need is higher, they can then access the public mental health system, for example, where they can get both clinical care in the community from the public mental health system, or they may need, depending on their level of acuity or how unwell they are, they may need a short stay in an inpatient type of bed to be able to stabilize and then return back to community. So that's the stepped care model. We're trying to build a system where, depending on your level of need, so if you are sort of experiencing psychological distress, your best option is not going to be going to the tertiary service. That's not what they're designed for.
Gotcha.
You go to where that's best for you and it can help you deal with that. If you have additional needs, you might need to go and see a GP and your psychologist, but if that's not working. So it's stepping up and stepping down depending on your level of need. And that's what that step care model is all about. And in Queensland, we've got most elements of that. But again, one of the challenges in the system, not just in Queensland or Australia, but internationally, is about making sure that step care model does not create gaps where people fall through it. And that's what we've got to bring that step care model together so that I can get the right response in the right location at the right time when I need it.
Yeah, I loved it. I it just kind of categorized everything into the
Yeah,
whole population, the vulnerable, the
yeah,
impacted, and the severe and complex. You broke it down into categories, and then you were able to really give an understanding of where those then people fall into, and then where they navigate to get support. No, that was well done, and I hopefully that takes off, and people out there in society can grab that and run with it. And that you talked about then the key considerations, the four main areas we need to focus on to help. You talked about messaging and communication, adapting service model and delivery, workforce, and maintain focus on mental health impacts over time. Is that directly related to that step model, or is that something that we need? Is that how the message is then delivered to people out there in society?
it's definitely related, but the messaging one is more broader. It's for everybody, because I think if you think about the messaging, and I look at our premier, our minister, chief health officer, or the prime minister, and the messaging they're giving us in terms of COVID-19. When it comes to mental health, it's really important that the messaging is framed around some of the positives, around hope, around control, around purpose, around meaning. All those things are critical in the messaging, because that can then help me psychologically deal with the situation. And what our leaders have done is also primed us for the next message. So, this sort of, today we're discussing this, but next week we're going to look at, discussing this, because we'll be at a different phase. We'll make decisions. That's really critical for our psychological well-being. In this current climate, the messaging is probably the biggest impact in terms of our psychological well-being. How the message is put across. Is it in a frame of hopefulness that we're going to get through this, that we are probably, doing better than any other country in the world, we're doing really well, and we've got to maintain our social distancing, etc., versus saying, we're still struggling, we're still, sort of not doing well, etc., and talking negatively about this whole situation to society. That's the difference in terms of psychological impact. I feel much better when someone talks to me about, we're working through this and we're getting over it, and we will come out the other end better for it.
Yeah, no, I definitely agree with you. And I know when I'm being given the information at hand, and the integrity of the information is correct, I feel a little bit more at ease. I know what's going on around me. I know how to adapt and what to expect. So yeah, can you then bring it back home now a little bit? And I loved you kind of brought it back as almost as a father. You were talking about how we can then communicate to our children and so forth. Can all that, all this steps of the levels here of communication and the key considerations be brought back into our family environment for those mums and dads that are watching now? Critical.
I think the way we communicate with each other as adults is critical about this as well, but also how we talk to our children. And I'll probably, in terms of adults, we've just got to be able to sort of, have those, factual conversations, rely on sort of credible data, be able to sort of, have the full breadth of the issues. Like, all of those things are important for us as adults. But when it comes to children, we've also got to take the time to talk to them. They're feeling, depending how young or old they are, they're feeling that there's a change. You need to be talking to them. You need to have time to talk to them about this. You need to be factual and open and honest with them as well. With children particularly, but families generally, but children particularly, because kids are usually part of families, it's about routine. Stick to as much of the routine with all the limitations. Routine is critical, because once you upset routine, psychologically, I feel everything's changed. As much of the routine, and even schooling from home, and you sit at your desk and you have school time, etc. Routine is critical. And then being able to be honest with kids, and also just reframing both for our adult relatives, friends and peers, but also for our children. That feeling anxious, like you talked about or I talked about, etc. We feel anxious. That's a normal reaction to an abnormal situation. That's not abnormal. That's a normal reaction. We all feel that, because this is unprecedented. So just validating that, I think, helps people to be able to deal with it. And I think they're the critical aspect. And then for both adults, but also children, and this is the stuff that I think you guys do really well, is that sort of focus on your physical health, your food, your diet, your sleep, your walking, your exercise, as best as you can with all the limitations, both for children and for adults. That's critical in terms of maintaining good mental health.
Mate, COVID-19, it's taken everyone by storm. What's been for you, from a macro perspective, what's just been the greatest lesson learnt during this whole COVID-19 pandemic experience for you?
Look, I mean, I think I could talk about that at the individual level. I mean, obviously, you know, I've experienced things myself with my own family, and, you know, all the fears that I have about my children and my, you know, my parents, etc. But the biggest thing that I've learned from a systemic perspective, perspective where I sit, is that we've made some changes to service delivery that we've struggled to do for 30 years. We've done it in 2 weeks.
Wow.
Before, to get things like digital consultations between GPs and the patient, or a psychiatrist and a person living with mental illness, to have a reduced focus on hospital care and supporting people in situ in community, because we didn't want people to come to hospital because we needed the beds for people that might get well. We saw that community care can work. We can support people. We've seen a change in the system, which has happened over, say, 2 or 3, 4 week period, which we struggled to achieve for the last, say, 20, 30 years.
What was it? Was it the red tape? Was it the fact that you just had to do it, and whatever happened, we'll fix up the collateral damage along the way?
I think it was that.
Was it the money?
I think it was that. We actually, we got allocated the authorizing environment to make some of these decisions fairly quickly and take a level of calculated risk, not risk generally, but calculated risk, to be able to support people in different ways rather than just our old traditional way of doing business. And so what my message now is, let's capture and consolidate some of that stuff that we've done. Let's not go back to where we were before COVID, and let's build on that. So let's take what was working well in mental health prior to this, and let's build on what we've achieved during COVID, and let's take mental health into a new era post-COVID.
Mate, look, separate topic now, Mental Health Week. Look, it's quite an uncertain environment out there at the moment. I must compliment the positive and the hardworking group that your working team behind the scenes have all stayed together and working hard to put the foundation in place for a mental health week in October. So a big shout out to all those people behind the scenes that have been working very hard. Look, the hard question is Mental Health Week actually happening this year in October?
From where I sit at the moment, yes, I think we will have Mental Health Week. The format of that we will know more once we get more advice from the Chief Health Officer and our authorities around what's possible, what's not, particularly in terms of larger gatherings and, physical distancing. But my view is, and my position is, that we should continue with Mental Health Week. Whatever happens, if it has to be a virtual Mental Health Week, let's do it, versus a physical one, like, for example, the Walk for Awareness, which I come to fairly regularly. Even the Walk for Awareness, we could, even in the current environment, we could do it virtually. I could do it with my family in my own suburb, still register as part of the event, and people could do it across the state in their own little location with only a small amount of people. We can still do it. So I'm still keen for people to continue to engage during Mental Health Week in the circumstances that's possible, because I think it's important to build on the work that you've done and a whole range of other people have done about raising awareness about the importance of mental health. And Mental Health Week is such an important event in our calendar that we've got to continue to do it.
Agreed. The famous words, the show must go on.
The show must go on. Yes.
Absolutely. The theme is connectivity. Now more than ever before, this theme is so important. Where is this theme birthed from? Was it birthed from the COVID-19 crisis, or is this something that you guys have had in the pipeline for a while now?
Look, I think connection and connectivity has been a theme over the years, because clearly, and if you look at it, particularly in the COVID-19 situation, one of the most difficult challenges we've had to come to terms with was, that sort of social distancing, as we've called it here. I mean, I call it physical distancing, and not being able to go out and see your friends, see your family, see your relatives, etc. So connection is so important. If you think about mental health, a big proportion of our good mental health is about having good social connections. And so we think, particularly in this particular climate where that's been challenged, and we've had to use a lot of other mediums such as digital platforms, that social connection should be a theme this year. We want to rebuild some of that. And people are coming to us now saying, I didn't realize how much I relied on my friends or my family, etc. I miss not being able to see them. It's psychologically having a negative impact sort of on me. People are looking for that. We as human beings, we thrive, and our resilience is built around having good social connections in our lives.
Well, mate, on saying that, if there's people out there that are wanting to get involved in the community, I saw that you guys have a COVID-19 immediate support grant set up where you guys have $27.75 million in grant funding that are going out there to services. Can you just explain a little bit about that and where they can find that information?
Yeah, it's if you go on to, you can actually come onto the Mental Health Commission website. We've got a direct link to Queensland Health. That's being administered by Mental Health, by Queensland Health. That's been allocated by the state government, and I'd like to particularly thank the Minister and the government for actually making those funds available. They're primarily going to the non-government sector. A lot of the money is going around these new innovative responses to people's needs, both mental health and drug and alcohol and other sort of related areas, but also some money is going to enhance existing services who are providing mental health community services to ensure that they can meet with potential increase in demand. But also, how do they get their digital platforms on, online? For example, a lot of people with mental illness don't even have a mobile phone. How do we support them and link with them? So money is available for a whole range of those things. People can come onto the Queensland Mental Health Commission website. There's information how to link to health. And I think primarily it's going to be easier if you already receive some money from health, if you have a grant, because then they can just sort of, assess you in that process. But also if you don't, it's worthwhile making a call to see what options are available to organisations that are doing work in this space and that they think they may need additional support.
Look, Ivan, I know you and I could probably talk about mental health and mental awareness all day. And I know my mum, who just walked in earlier, how embarrassing, loves the sound of your European voice. But look, we'll wrap things up there. I do have, we do move into 5 quick, short questions, something we do at the end of every interview. But look, just anyone listening to this interview and is feeling down of anxiety or depressed, there is help out there. Reach out to Lifeline on 13 11 14, see your local doctor, or just speak to a friend. But hey, it's called the quick draw trivia, okay, Ivan. So where you'll be asked 5 quick random questions, and you have to respond within 3 seconds. Are you willing to give this a go?
I'll give it a go. I'm not sure I'll do well.
Okay. Pineapple on pizza or no pineapple?
Pineapple.
Good man. Are you a cook or a takeaway man?
The cook.
Okay. Budgie smugglers or board shorts?
Board shorts.
And will you be running for state premier at the end of the year?
Definitely not.
Well, on that note, Ivan, it's been an absolute pleasure having this 30 minutes or just after 35 minutes with you. It's always great to get a grasp of what our commissioners and our people are doing behind the scenes to help make all this possible, because I know all these programs, all these initiatives, all this funding, I think people forget about how the hard work that people like yourself are doing in the background, and your team, Ivan. And we thank you and we thank your team there as well. And we thank you for this opportunity to spend some time with us.
Thank you as well, and the work that you do. And I think it's fantastic, the level of awareness you brought to mental health through the work that the Mental Awareness Foundation and both you and Ves do is phenomenal. And so thank you for that. And we certainly appreciate working with you.
All right, Ivan, you take care, mate, and have a good evening.
See you. Good night.
Bye now.